Hi, and welcome to this workshop, which is all about understanding and overcoming anxiety. It's another in the series of health and wellbeing books, and they're available online on YouTube, and it's all to do with a new book which is called Understanding and Overcoming Anxiety. So this book is a practical self-help guide for anyone needing to understand anxiety and its symptoms and consequences. In the modern world, anxiety is very common and on the increase, affecting millions of people. Yet with more knowledge and insight, it is possible to manage and overcome these issues. The book will be available on Amazon and on iBooks to download, and also paperback versions as well. And I'd really strongly recommend you reading the book. So although this workshop will hopefully be informative, interesting and beneficial, there's much more content in the book. It's an easy to read book, no big words, not long-winded, very straightforward and practical. So please get a copy, and hopefully you'll learn much more about anxiety and be able to overcome any issues you may have, or people you care about, they might have those issues as well. So as an introduction, anxiety will affect everybody. Everyone gets nervous, gets anxious, worries about things. They're on edge at times for different reasons. Going flying, or having a meeting, going for an interview, going on a date, going to the dentist, all these things. And that's normal, that's common. But for many people, their anxiety will really have a very negative effect on their lives. And so we want to go into much more detail around what anxiety is, and what you can do to firstly understand all the different types and reasons for it, and also then what you can do to help overcome those issues. A few facts about anxiety. Around 1 in 10 people will suffer from mixed depression and anxiety at any time, and as many as 25% during their lifetimes. It's the most common, most prevalent mental health condition in the UK and modern developed countries in the world. And it's the most common reason for people going to their GPs. However, most people with anxiety will actually not seek help in that way. A few more facts. 1 in 90 people will suffer from panic attacks, panic disorder. Around 1 in 55 people will experience some kind of phobia. And women are actually twice as likely to experience phobias than men. Post-traumatic stress disorder will affect around 1 in 35 people. Obsessive compulsive disorder, around 1 in 40 people. Lots of different types of anxiety which we'll come on to, but in general, women's anxiety levels are higher than men's. And people in their middle years, around sort of 35 to 59, they have the highest levels of anxiety. So let's go into more detail around what anxiety is. A definition: a feeling of worry, nervousness, or unease about something with an uncertain outcome. Now, people who experience anxiety will be able to give a much better description of how they feel, how they act, how they behave, etc. But it's all around their thinking and thinking anxiously. And there's various sort of common examples of the types of thinking anxiously that we're just going to go into now. So, racing thoughts. This is when people, overthinking, it's almost uncontrollable. They're unable to switch off, unable to relax, all those racing thoughts all the time, and it's sort of on edge, continuously. Very difficult to just relax, calm down, and just basically be rational about things. Then there's poor concentration. You can't focus, you have a very poor attention span, and even your short-term memory is affected. Then there's approval addiction, and this is really about where people worry about what other people think of them. Constantly worried, what are they thinking? What am I doing? Where people are going to be making judgments, assumptions about me, and they need that kind of approval of people. They're always seeking that approval. A worst case future. So people are always looking into situations and events where it's a worst case scenario, very negative about the future in their lives. Magnification. So people will take particular events, situations, circumstances, past, present and future, and just basically magnify it to the really, really negatively in a bad way, and get more and more anxious about that. And then you've got perfectionism. So where people always striving for perfection. Now that's very achievable. So anything that isn't perfect, they will see as a mistake or some kind of failure, and again, be very anxious about that. So they're sort of very common types of how you will think anxiously. In terms of symptoms, there's it's probably best to put these into two categories: your physical sensations and then the psychological sensations. So in terms of physical sensations and symptoms related to anxiety, nausea, feeling sick or actually being sick, tense muscles, maybe headaches, pins and needles, particularly in the arms, feeling lightheaded or dizzy, maybe feeling too hot, too cold. Your breathing will be affected, usually much, much faster. Sweating, hot flushes during the day and at night, a fast, thumping heartbeat, which you can feel and you get more anxious about that. Raised blood pressure, difficulty sleeping, needing to go to the toilet more frequently or sometimes less frequently, and then that churning in the pit of your stomach, and then potentially experience panic attacks. In terms of psychological sensations then, feeling tense, nervous, on edge, having that sense of dread, fearing the worst, feeling like the whole world is speeding up or slowing down and you can't control it, feeling like other people can see your anxiousness, they can tell that you're anxious and that makes it worse. Feeling your mind is really busy with different thoughts, usually negative ones, and dwelling on those negative experiences or thinking about a situation over and over again, that overthinking, and then feeling restless, not being able to concentrate, and that feeling of numbness. So lots of symptoms, sensations, characteristics, behaviours, both physically and psychologically. None of it is pleasant, none of it is good, none of it is helpful. So we want to try and understand why that's the case. Why do people feel like that and behave like that, and then what you can do to overcome that. First of all, I think it's really important to actually ask yourself or try to understand, is it anxiety? Anxiety can be a cause of many, many different issues, behaviours, thinking, and it can be the effect of various different issues and conditions. But it might be something else. It might be that you focus on this is anxiety, but actually there's other issues that need to be addressed and focused on, and anxiety will improve as a result of addressing those issues. There are many other related issues with anxiety, and some of those most commonly are depression. So with depression, many of the symptoms and behaviours are closely related, and often depression and anxiety will go hand in hand. But there are also big distinct differences as well. And stress, again, anxiety, stress, depression, there's a lot of crossovers there. I would advise, if you haven't already, to take a look at the book, which is around managing stress and preventing depression. And there's a book and also an online workshop in that area too. Also confidence. Often your confidence will become much lower as a result of anxiety, but also your anxiety will often increase if your confidence is low. And again, there's a book around confidence and a workshop all around understanding and building confidence. Then you've got things like alcohol. People will often turn to alcohol and drink more to, help with their depression. Now, that's rarely the case, and that alcohol use can lead to other issues. Also, taking alcohol can be one of the causes for anxiety. So you need to understand and be very careful around alcohol use. In the same kind of way, drugs as well, whether that's recreational drugs, soft drugs, prescription drugs, or even hard drugs. Again, there's a lot of dangers with that, and people can take drugs with a lot of anxiety, and drugs can cause anxiety. Sleep is a big issue. Sleep is really, really important physically and mentally, and with anxiety, often your sleep will be affected. In fact, it's probably the main cause of lack of sleep or poor sleep quality is anxiety. Again, there's a workshop and a book called How to Sleep Better, which will hopefully give information and advice in order for you to help address any sleep issues you have. Then there's exercise. Exercise is a fantastic way of helping to increase confidence, increase self-esteem, increase your physical health and mental health, but also to lower anxiety. So exercise, I'm a big believer in how beneficial that is, all different types. And again, there's a workshop, a book called The Real Benefits of Exercise, which again will hopefully give you that information and advice and motivation to do more exercises. It's really beneficial. And finally here, food. What you eat can play a major role in how you feel. So whether that's overeating, comfort eating, not eating enough, not eating the right things, how that affects your mood, your confidence, depression, stress, anxiety, all those things. It's really important to understand the effect that food has. And there is another book and a workshop around healthy eating. So again, I would look at the other books and workshops in this series because a lot of this is all related, and usually with these different issues and conditions, it's not just one thing, it's a combination of many different things you can do to improve your overall health physically and mentally. I think it's really important to understand the role modern life plays in these sorts of conditions. With all these issues, particularly anxiety, it increases as we develop in the world and modern society. With all the benefits we have and all the advances, actually issues like anxiety increase. So why is that? I think a lot of it is to do with the fact that we've got so much information and we're constantly being told different things. You know, the media sensationalizes things, and people with anxiety, that tends to make you think of, you know, worst case scenarios and worrying about all sorts of things. There's also the fact that you know so much about other people, you know, friends, family, colleagues, just, you know, celebrities, and you're constantly being fed all this information. You can see all of this, and there's a natural kind of sort of way of thinking of I want what they have, or what are they doing, or my life's not as good as theirs, and that those comparisons, that jealousy, that envy, and it creates a lot of anxiety and stress, and it can lower your confidence. And so all these different effects will have an impact. There's also the social media, whether it's Facebook, Twitter, Snapchat, all these different things. Yes, they can be really beneficial and helpful in many ways, but actually they can cause a lot more stress and anxiety. I just want to give you an example of something, you know, a bit of modern technology where people making so many assumptions and judgments about things can really, really increase their anxiety and cause lots of problems. So many of you have heard of WhatsApp, and I'm sure a lot of you use WhatsApp, which is like an instant messenger application. So it's different from just normal text messaging. But if you've got a situation where, let's say, your partner or your husband, wife, boyfriend, girlfriend, or someone you might be dating or something like that, and with WhatsApp you can tell when they're using the application, when they're online, when they last used it, unless you switch that off, which in itself causes suspicion. So if you send a text, you basically want a reply. And if you don't get a reply, you start thinking, you know, why is that? Why aren't they replying? What's going on? And if you can see that they've seen that message, they've been online, they're online, you know, who are they talking to? Why haven't they replied? You know, who else are they speaking to? And, you know, what's going on? And you start to make all sorts of assumptions in a very negative way, which builds up that anxiety. Now, in many cases, in most cases, those assumptions are just, you know, completely unhelpful and unjustified. It could be that someone isn't able to respond. You know, they're driving, they haven't got signal, or they're chatting to a friend who needs their help, or it's a work-related issue, all sorts of things. So in that situation, people, particularly with anxiety, will come to their own conclusions in a very negative way, and it causes all sorts of stress, tension, anxiety. So that's just one example where, you know, modern life can cause these issues. So I think it's really important to understand, you know, what sort of technology you use, what sort of things go on, and how that can help. I'm sure that, for example, with Facebook, people who don't use Facebook probably have a much more straightforward life, and without that anxiety. Now, you know, pros and cons of these sorts of things, but just think about what you can do in that respect to help reduce and manage your anxiety. Let's look more about the different types of anxiety, because it's not just, you know, one particular thing. There's lots of different types. Some of them will be closely related. You may potentially have several of these or just one distinct one. But in no particular order, you've got generalized anxiety disorder, GAD. Now, this is the most common. It's as it suggests, a generalized anxiety, thinking about things, worrying about things, on edge, and it's the most common form of anxiety, but it's much more general. You've got social anxiety disorder, and this is where people have a real fear of social situations, what people are thinking of them. They're really worried about what they, will they make a fool of themselves? Will people make judgments about them? And they look to avoid situations where that might be the case. So they perhaps don't go to events, or don't do things, or hide themselves away in that respect. Or they get very, very nervous and anxious in any of those sort of social situations. You've got agoraphobia, which is different in the sense that this is more about the fear of particular situations. It might be wide open spaces. It could be a shopping centre full of people. It could be that fear of those situations where they get really uptight and on edge, and they avoid them. So potentially people in that situation will just become quite reclusive because they avoid all those situations. Obsessive compulsive disorder, OCD. Again, this can come in many different forms, but it's where people have to do certain things in a particular way, a particular order, and if they don't, they get even more anxious about it. And that can really sort of control their lives in all sorts of situations, at home or at work or in social situations. Post-traumatic stress disorder, PTSD. This is where a particular event, a traumatic event, has occurred in their lives, and they can't get over it effectively. They have flashbacks, they have nightmares, they think about it. Certain situations will trigger off those thoughts in a very negative and disturbing way. Phobias, all different things, whether it's a fear of flying, a fear of snakes or spiders, all different types of phobias that can really affect someone in a major way. It's not just being scared of something or not liking something. It's a really difficult situation for someone, which can lead to potentially panic attacks, which is another type of anxiety, where someone, it could come very, very quickly, where they suddenly can't breathe, there's a tightening, there's a complete panic, and it can last them for hours and hours, even though the actual panic attack may be only say 5 or 10 minutes. And people then who've suffered panic attacks are always worried about getting another panic attack, which in turn makes it more likely to happen and has a major effect on different aspects of their life. Body dysmorphic disorder is really where people have this fear or anxiety, worry, concern about their body image, maybe a particular part of their body, and again that can have major issues because of the body. It's with them all the time, and in certain situations they may avoid, they may get really stressed and worried about situations. Then you have health anxiety, which is where people are effectively sort of hypochondriacs, i.e. they're constantly thinking about a health issue which they may have or they might have, or they might go to their doctors regularly saying, can you check me out with this, can you check me out with that, and they're always thinking the worst in terms of their health. Obviously they don't want to be ill, they don't want to die, they don't want to have any sort of terminal illnesses or conditions, but they're so worried about their health that they overthink everything and think something's up. So there's a wide range of different types of anxiety, and some people might have literally all of those or just one particular one. It's important to try and understand, if you do suffer with anxiety, where do you fit in with that. So part 2, we're looking at the causes and reasons for anxiety. It's really important to try and understand why one person will suffer from anxiety and someone else doesn't. What are the underlying reasons and specific reasons? So in terms of underlying reasons, genetics you are born with a set of genetics, your DNA, that's not your fault. It's hereditary, but for certain people that will lead to them more predisposed to getting anxiety or other issues like depression and stress, etc. Their sort of personality as well, which is partly genetics, but also their upbringing. Their experiences in childhood, particularly, whether that's with their parents, their siblings, friends, families, different experiences they've had, particularly as a child, can have a major effect. And usually, conditions like anxiety are come about from their upbringing. And that also includes education. People, obviously, children spend a lot of time at school, and so they're, people at school, their teachers, different circumstances that occur, all those are likely to have a big effect on potential anxiety for the rest of their lives. Then you've got specific experiences that may have happened during your lifetime. So whether that's something that may potentially lead to the sort of post-traumatic stress disorder or general anxiety, certain experiences in a negative way, if you don't deal with those properly, don't understand them, don't look to overcome those, will play a part, no doubt, in anxiety levels. Then you've got hormones and brain chemistry. It's all very complicated in terms of how the brain works and the different neurotransmitters, etc., and the different hormones. But they will play a significant role in how you feel, your moods, and your confidence, your self-esteem, all these things. And for example, with women, the menstrual cycle or menopause, the different hormone levels, that can play a big part in terms of anxiety. And then there's habit. It's very easy to get into a habit where your anxiety and the way you behave and the way you act and the way you think becomes a habit. It might be that actually, once you address those and realize that it is effectively a habit, you can then deal with that. But be really careful that your behavior isn't just habitual. And if it is, then in a way that's a good thing, because you can then look to address that. So they're probably the sort of main underlying reasons. And then there's specific reasons. Lots of people throughout their lives will go through all sorts of ups and downs, good and bad. But many things will, really almost in an obvious way affect their anxiety levels. So, for example, financial issues. If you've got money problems, debt, perhaps you're out of work, you're not sure about your income, you've got particular bills to pay, you've got expenses coming up, anything to do with finances, that can really lead to anxiety increasing significantly. Relationships, if you're in a relationship where there's all sorts of potential issues or concerns or worries or insecurities, that can obviously increase to higher anxiety. It could be an end of a relationship, a divorce. It could be that you're single and that causes anxiety. You don't want to be single and all the potential expectations that go with that. So relationships is a major issue relating to anxiety. Work and career, not just in terms of financial, but it might be having problems at work, potential bullying at work, or you're not being recognised, or there's too much pressure, too many expectations. Where's your career going? You're not in a job you like. You don't want to be doing it. You can't see a way out. You don't know what the next steps are. All sorts of things related to work and career will potentially cause anxiety issues. Getting old and death. A lot of people fear and have anxiety related to getting older and then dying. Very common. As too is loneliness. Many people are very lonely, and it's not just older people. People at all ages will be in situations where they really feel lonely, which heightens their anxiety levels. There's also sort of specific reasons related to the welfare of loved ones. If there's people in your life that you care about, your parents, your family, your children, your best friends, and there's concerns around their health and their welfare, that can cause a lot of anxiety for you as well. And then finally, in this area, body image. A lot of people, again, men and women, all ages, will have real anxiety around the way they look, and their body and everything around that. So I think it's important to try to understand, what are the reasons, what are the causes, those underlying reasons and those specific reasons. And then you've got, the effects of anxiety. There's so many negative things around anxiety, which is why it's so important to try and understand as much as you can about it, and then look to try to manage, overcome, prevent, reduce, etc. So the effects of anxiety. You've got overall health, the physical and mental effects. Sleep, we've sort of touched on before, but sleep is so important, and anxiety will generally cause a lack of sleep. You're restless, you're overthinking, you're not sleeping well, and that has a knock-on effect in all sorts of ways. And you're tired, you're more irritable, you perhaps lack the motivation to do things that are going to be beneficial for you health-wise. And it can also affect your partner as well. Then you've got your weight, whether that's losing a lot of weight or putting on a lot of weight. Both are unhealthy, both are not good for you, and will cause additional issues. So anxiety can lead to a lot of issues and problems around weight. Alcohol, cigarettes, drugs, etc. There's a real temptation to use more alcohol and cigarettes and drugs if you're feeling anxious. You want some sort of fix, you want something to make you feel better, to help you relax, to make things go away, etc. And in pretty much all cases, those kind of answers are not going to be good for you. Then you've got confidence. Confidence, in my view, is very often the main cause, or lack of confidence is the main cause of so many issues. People will look to put a tab on things in terms of it's anxiety, it's stress, it's depression, all these things. But actually, in a lot of cases, the underlying thing is your confidence, and you have to work on building your confidence, understanding why you're not as confident as you'd like to be, and really address that and build that up, and everything else will improve as a result. Your productivity, if you're anxious, if you're thinking about all sorts of different things, your mind's racing, you're not sleeping, you're not doing all these things you'd like to do, your productivity will fall, whether that's at work or at home, in your whole life. You're just not doing the things that you could be doing, you're not achieving the things you want to be able to do. Relationships we've touched upon, but anxiety will no doubt put a lot of pressure, a lot of strain on relationships, not just with partners, but with friends and family. It can be very difficult for people to understand what you might be thinking, your behaviours, what you're doing. You may be making a lot of assumptions and judgments in a very negative way about those people, those relationships. And no doubt a lot of relationships are affected because of anxiety. Friendships, we've mentioned in terms of relationships, but friendships, it's really important to have people close to you that support you, that you can trust, that you can confide in, that you can spend time with, you can socialise with. And if you're suffering with anxiety, then there'll be a lot of strain on that, and that's another area which can have a big effect, a knock-on effect to all sorts of other issues. Your work, so not just in terms of productivity, but your desire, your ambitions, your motivation, your actual quality of work is likely to suffer as a result of having anxiety. You'll also have much more sort of paranoia. You'll think of worst case situations, you'll become more paranoid, you'll make those negative assumptions. And if you go through life with all these kind of this paranoia, this constant worry and concern, obviously it's going to have a knock-on effect to pretty much everything. And as we touched on before, it becomes a habit. Anxiety, like with many of these issues, it becomes a habit. You almost get used to it. You get used to thinking in a negative way. You get used to worrying. You get used to being on edge. You get used to not sleeping. You get used to not eating properly. All these different things. It becomes a habit, and it's very, very difficult to get out of. A vicious circle, which once you're in there, it's very, very difficult to break that habit. So a lot of negative effects of anxiety. So it's really important to try to understand anxiety and there's a lot of situations where there's a natural reaction to certain situations and events where you will be anxious, you will worry, you'll be nervous, you'll be slightly on edge, that apprehension, and that's normal. And it's important to understand, what would be normal and what would you deem unnormal, as in, it really is anxiety. So, a situation or different situations through life where, there'll be a natural reaction, and it can be a good thing at times. But try to rationalize the situation. Try to think, are you being overly anxious about situations? More often than not, would somebody else, perhaps looking in from the outside, deem this normal or not normal? And really be honest with yourself as to, do you suffer with anxiety or not? Is it normal? Is it not? Try to understand yourself. Try to get as much sort of information around your genetics, your upbringing, your experiences, why you behave certain ways, why you think certain ways, your personality. Try to understand yourself, and it's really, really important. And then it will help you to realize, what sort of anxiety you may be dealing with. What are the reasons, the underlying reasons, specific reasons. So understanding yourself is really, really important. And reading the book and reading the other books will help with that. And also taking time to think about, who you are, and whatever age you are, whatever situation you're currently in, try to understand, who you are and why you feel, think, behave, act in certain ways. A book that I would really recommend, that I've mentioned before in other workshops, is The Chimp Paradox. It's a fantastic book by Dr. Steve Peters, which really talks about the brain and distinguishes between what he calls the computer, the chimp, and the human. And very briefly, I'm just going to a very quick overview of this, because it really does help with anxiety. The computer part of the brain will be basically all your experiences, good and bad, to date, and everything you think about and behave and act upon is based upon your experiences to date. So if you've had a lot of bad experiences, you're more likely to sort of think in a negative way, because you're almost used to those bad experiences. Whereas if you had lots of good experiences, you're more likely to be thinking in a more positive way. Now that's very general, but it's important to try and understand why you think about certain situations in a certain way, and all of that will be based upon your experiences to date, and understanding kind of what effect those experiences have had on you. In terms of the chimp, this is the central part of the brain, and it's very emotive, it's very reactive, it's very irrational, and I guess it's moody. And you can imagine a chimp out in the jungle or forest. They're all about survival. They're looking for threats. Is someone going to attack them? What's going to happen to them? They need to really, really look after themselves. They're very aware of situations, but they are very reactive. Whereas the human part of the brain, which is the frontal part, is much more mature and rational and sensible, and will base things on facts rather than assumptions and judgments. So there's a very strong contrast between a chimp's behaviour and thinking, all around survival and reacting to something, and worrying about threats, to a human, which is much more rational. It will take its time. It will be sort of mature and more sensible, but it also needs purpose and fulfillment. And in terms of having a more sort of controlled life, it's about having the human being able to manage the chimp in situations, so that you don't react, you don't make assumptions, you don't become too emotive about situations, which can be very, very difficult to do. This chimp is very, very strong, and it's really about the human using that intelligence to manage the chimp in situations. In the Understanding and Building Confidence book, there's much more detail about the chimp paradox, and in that video But I would strongly recommend reading the book in detail, trying to understand more about the brain, the different elements, the computer, the chimp, the human, and see where that really fits into your circumstances. And you'll recognize when you're in chimp mode and opposed to human mode, and then look into how you can manage that situation, have the human manage the chimp. Other people have a huge impact on your life. I mean, that goes without saying, but with anxiety, more often than not, people are very concerned, very worried, constantly thinking about what other people are thinking of them and their influence on them. So it's important to understand or try to work out why are you so concerned about what other people think of you. Don't make assumptions about their lives, because the chances are you don't really know what's going on. So you may be thinking, oh, they have a wonderful life and you want that, and you're getting jealous and those very negative emotions. But also it's important to have people in your life that are right for you, aren't a negative influence. They will support you, motivate you, encourage you. You've got that trust and loyalty. So really think about the people in your life, particularly those close to you, good and bad. And if you can, really focus on the good people in your lives, and if you can, get rid of the ones that are a negative influence, the ones that cause the anxiety, the ones that don't help the situation. You've also got the security. I mean, it's really important to have security in all sorts of different ways, whether that's financial security, whether that's work, career, whether that's a partner, family, your health, all those situations where security will lower anxiety, and if you feel that you've not got that security, that will heighten and increase the anxiety levels. And there's also fears and worries. People will have all sorts of fears, that most of which will have been sort of learned during their lifetime, and can be quite irrational. And if there's particular fears that stop you from doing something or really increase that anxiety, then to be honest, the best way is to confront those fears, to face those fears. You may want to seek help, you may want to seek expert advice, but if you can face those fears, then that will be a huge confidence boost and will lower the anxiety, and in nearly all cases you will be okay. You will face those fears and everything will be okay. There are situations where it might be just the best to avoid those situations so that fear doesn't build up, but it's really important to deal with it. And in terms of worrying, we'll come on to this a bit later in more detail, but worrying really doesn't help. It just takes away any kind of peace, and you've got to be really honest with yourself as why are you worrying about these things, these situations, these people, these events, what's going to happen, all these assumptions and judgments. You've got to try and tackle those worries. So it's important to try to understand the reasons for anxiety, the types of anxiety, why you're particularly anxious in certain situations, and what you can do about it. In part 3, we're now going to look at lots of what I'd call self-help recommendations, things you can do practically that will hopefully reduce anxiety. And I'm a huge believer that if you do this, you address it, you're honest with yourself, you take the time, you take the effort, your anxiety levels can really, really reduce, both in the short term and also going forward in the longer term. You can be in a situation where anxiety never has to be an issue. You can manage it and be in control. And control is probably the first thing that you need to try and focus on or understand. If you don't have control, if you're not in control and things are very uncertain, that will naturally cause uncertainty. So I think it's important where you don't have control and you can't do anything about it, to recognize that you can't do anything about it. So stop thinking about it, stop worrying about it. You can't do anything, so don't do anything. Focus on things you can control, things you are able to deal with, and try to, again, be honest in those situations and really think, is this going to help me or not? Can I control it or not? Let it go if you can't. Just stop thinking about it. Worrying and overthinking. Now, a lot of people will say they overthink, and they do. So how can you stop that? How can you stop overthinking? Again, a lot of it comes back to, will this be helpful for you? Will this actually help the situation? Will this be a good thing for you? The answer is no. Try to focus on the things that will be beneficial. Overthinking often, completely irrationally and thinking about things that just aren't true. You haven't got the facts. Only think about things where you have that detail, you have that information, you have the facts. Stop worrying about stuff you don't know anything about. And you've just got to keep practicing and practicing that. So whenever you're worrying, you can sense that overthinking, that worrying, just ask yourself, is this helping or not? Do you have the facts? Do you have the information? Do you have the control, etc.? The answer is most likely to be no. Just stop worrying about it. And the more you practice that, it becomes easier to stop worrying about it. So just keep practicing and practicing. Something that's, I think is a really good tip is, in any situation, think about what you would advise a best friend if they were in that situation. So if a best friend, someone you cared about, someone you had a lot of time for and you wanted to help, and they came to you with the issues that you've got, what advice would you give to them? And usually that would be the advice you should give yourself, and you should take that and accept it and do something about it in that way. Also, it's important to be your own best friend. You've got to like yourself. You've got to want to, care for yourself and do the right things for yourself. So again, being honest, taking that time to think, what would you do to a best friend? Therefore, do that to yourself. Take that advice. Do the things that are going to be beneficial. Questions to ask yourself. So, for example, how important is this really? Will this matter in a year's time? Ask yourself about, do you have the facts? Do you have that information? Is it something you can control? What would you advise someone else to do? What would someone else do? Just ask yourself all these questions. Try and get some, rationality on the situation. And it might be best to do that by writing it down. Ask yourself the question, then write it down. Give yourself that bit more time and clarity on the situation. Negative thinking, it's not going to help. Negative thinking is very common. You're going to be thinking stuff, worst case scenarios. What if this happens? What if that happens? And it manifests into more negative thinking. You've got to try and stop that sort of vicious cycle of one negative thing leads to more negative things, etc. It's unproductive, it's unhelpful, and just again, be honest with yourself. Is it negative? Stop it, or try to turn it into a positive. Take a situation, take an event, take a person, whatever it might be, and try and turn that negative into a positive. Then it's sort of around these triggers you may have. So there's triggers and what's called anxiety-provoking assumptions that are likely to cause the increased anxiety levels and this kind of negative thinking and this unhelpful behaviours. So it could be around the perfectionism we mentioned before. If you're constantly looking for perfection, it's very unlikely to happen, and you'll see things as mistakes and failures. And if you're put in a situation where that's the case, then understanding that is likely to happen, and you've got to realise that it's unlikely to be a mistake or a failure. It's about doing your best. You can't get perfection probably any of the time really, but doing your best and understanding that might be a trigger for your anxiety. There's the vulnerability, putting yourself in a situation where you're feeling vulnerable and the anxiety increases, and can you avoid those? How can you deal with those situations? There's the control we've mentioned about, are you in control or not? Can you be in control or not? And trying to get away with, just if you're not in control, don't do anything. You can't do anything about it. Move on, focus on something you can control and will be beneficial to you. The approval thing, trying to seeking people's approval on certain situations. Why? Why do you need that approval? How important is that really to you? Are you going to get it? Do they have the information? Do they have the facts? Are they? Do they have your best interests at heart? All these sorts of things. Try to move away from that. And dependency on certain people, certain situations. Just try to ask yourself, why has that anxiety built up? What are those triggers? What are those assumptions that you're making that are going to be harmful and unhelpful? And assumptions so often are wrong. You've got to base your thinking on facts. Something that's really beneficial is this whole notion of travelling light. Free yourself from as much baggage as you can. The lighter you are in terms of free and without all those burdens around you, the less anxious you're going to be, the better your life's going to be. Obviously, there's things you're going to have with you. And certain events are going to have some element of baggage. But the more you can get rid of, free yourself from those burdens, you will feel so much better. It's a huge relief. That anxiety will go, and in most cases, you can be responsible. You can be in charge of getting rid of that baggage. Traveling light, it's really, really helpful in so many ways. Making assumptions and judgments. Obviously, we've sort of mentioned this, but it is so dangerous to make all these assumptions and judgments. Yes, you need some intuition. Yes, at times you're going to have to make judgments and make calls on situations, but try to have an open mind. Try to get all the facts and information. And the main reason is that people will make negative assumptions. They'll look at worst case events, scenarios, become paranoid, etc. Particularly if you're suffering with anxiety, that's just going to build up and make everything worse. So try to avoid assumptions and judgments. Jealousy and comparisons. Again, we've touched upon it, but it's such an unhelpful, harmful emotion and behaviour to have. If you start to get jealous about someone else's situation or their lives or what they have and comparing yourself to something else, the actual situations, you very rarely know what's going on in other people's lives, what's going on behind closed doors, what's going on in their head, what's going on at work, etc. So, jealousy is very negative, comparing, very negative. You're unlikely to get the real answers, the real truth. Focus on your life. Focus on what you can do to improve your situation. The right and wrong people in your life. Everybody will have people in their lives which are a negative influence, which aren't good for them. Whether that's someone really close to them or someone in a work situation or in a family member situation. It's really important to try to identify those people, and if you can, try and get rid of them, or try to confront the situation and deal with it. It might be a case of poor communication. It might be that those people just you just don't want them in your lives. Try to focus on the good people, those people who will support you, understand you, will think about you, will be loyal, you can trust, and you can communicate with. And having the right, what's called the inner troop, the right people in your lives will have a major positive impact in all sorts of ways, and particularly with anxiety. Social interaction. Humans are naturally social creatures. It's important to be social, to talk, to communicate, to spend time with. And often people with anxiety will avoid those situations. They feel very uncomfortable in that, and their social skills, their social interaction will decrease. So it's really important to try not to let that happen, and to spend time with people you do feel comfortable with. the right people, and to put yourself in situations where there is that social interaction in different ways. And it might be a case of building up slowly or re-engaging with different people. But if you find yourself being quite reclusive or being constantly worried or anxious about social situations, you've got to address it and do something about it. Being social is good for you. It's a natural, human behaviour. So try to focus on that. Building confidence. As I said before, confidence is so important for people in all aspects of their life. The more confident they are, generally the happier they're going to be. They're going to achieve more. They're going to be doing more things. They're going to have more experiences. They're going to have less worry. They're going to sleep better. They're going to have better health physically and mentally. And confidence is something that you can build up, you can work on, you can increase it in lots of different ways, and there's many different elements to it. So if you feel like most people would, that you want to improve your confidence, then focus on that. That will often be the sort of starting point to really understand the different elements of confidence and build that up. Facing your fears, we've mentioned, but confidence will increase if you face your fears. Facing your fears will also mean your anxiety will decrease, because actually it's not something to be fearful of. So many examples of things you can do to face your fears, and in nearly all cases it will be such a good thing to do. You may want help with that, support with that, advice with that, but you can't go through your life being fearful of all sorts of different things. It's such a negative impact. So go for it, face those fears, get the help, get the support, get the advice, and you'll be okay. And finally, here, instant sort of help tips. Things you can do that in any situation that might help reduce that anxiety. So, for example, music, fantastic. Put some music on, sing out loud. Have a favourite piece of music that you can turn to, which will help to relax you, to calm you down, to help with anxiety. Breathing exercises, deep breaths. Try to gain control of the situation. It might be some people use like a rubber band on their wrist and just just do this, just to have something to do to take their mind off the anxiousness and the thinking. And you could rub your thumb here to release pressure, to relax. Again, little things that may be beneficial in particular circumstances. There's always something you can do. So if you find yourself in situations where your mind's racing, you can't stop thinking about something in a negative way, you're getting really nervous, lots of different things you can do which might just help in that situation. But then there's the what I call the anxiety toolbox. So for people who've read the other books and watched other videos, there's what I would call a toolbox that's really important to have in any situation, whether it's the confidence, depression, anxiety, stress. If you've got your own toolbox that you can go to at any time to pick out something that is going to help a situation, either instantly or in sort of short, medium term, then go for it, use it. The more things you have in a toolbox that are going to be beneficial for you, then obviously the better. And it's something that you never want to be in a position where you don't have options. You always want to have something you can do no matter what's happening that will be beneficial for you and help you in a situation. So think about building your own toolbox, having all sorts of different things in there that you can go to pick out that's going to help a situation. So in terms of anxiety, the sort of things I would recommend putting in your toolbox, music, we just mentioned it, but listening to music, having favourite songs, singing out loud, playing a musical instrument, anything to do with music, it's such a great way of relaxing, to taking your mind off things, to giving you that little boost, that put a smile on your face. It's really, really effective, but so simple. Exercise, is so beneficial, so many ways, all sorts of things you can do, whether that's going to the gym, going for a run, going for a walk, cycling, dancing, whatever it might be, exercise, getting your heart rate up, working on your different elements of different areas of your body. Sometimes it can be done in teams, in groups, as a partner, or on your own. There's all sorts of different options and opportunities around exercise anyone can do, whether it's at home or outside. So really think about what you can do in that respect. Walks, obviously that's exercise, but just the simple fact of going outside, getting some fresh air, seeing some different scenery, hopefully sunshine, getting the sun on you, the vitamin D, that's beneficial too. Just seeing other people, going to parks, seeing lakes, trees, etc. Just getting outside, whether it's for 10 minutes or a couple of hours, walking is a really, really good way of helping any situation like that. Relaxation, lots of different ways to relax, whether that's just taking some time out, just lying down for a bit, watching something on TV, talking to someone, meditation, breathing, whatever it is, just spend time on relaxation. Try to, rather than seeing it as a something that is almost a nice to have, look at it as something that's really important, something you should do every day. Take time to relax. It could be as simple as having a bath or a shower. Something's going on, you're really you're upset, you're anxious, you're worrying, you can't, it's taking over your life in that situation. Go and have a bath or a shower, just for whether it's 5-10 minutes, half an hour. That can be really, really effective. Massage, yoga, meditation, those sorts of things too. Obviously, in terms of relaxation, but taking your mind off things, trying to get that control back in terms of stopping those racing negative thoughts. The me time. So many people, particularly people who have a lot of responsibilities, let's say a mother with their children, and all sorts of different responsibilities. It's important, rather than putting all their effort, all their time on other people, to take some time for themselves. A bit of me time, just to do something that's good for you, whether that's 10 minutes in a day or an hour in a day, or every few days, just taking a bit of time out for yourself. Really, really important. Don't neglect yourself. It's your life. You are the most important, and if you're in a good place, then that's going to help people you care about. Talking to people, talking to friends, potentially talking to professional help, but talking is really important. When stuff's going on off in your head, it can get worse and worse and worse, more and more jumbled, more and more chaotic. And by talking, you may not necessarily get particular answers, but it will help unjumble that sort of stuff that's going on in your head. And generally, it's going to calm you down, and you're going to be clearer in your thinking as a result of talking to people. But make sure you talk to the right people. People who will listen, will empathise, will understand, will listen to you. But talking, very effective. Try to shift focus. So let's say you've got something on your mind that you just can't get rid of, and it's really, really causing that anxiety. Try to shift focus. Have things that you can think about, whether they're real or not. It might be you start thinking about a holiday and planning that, and everything to do with where you're going to go, what you're going to do on that, what preparations you need to make, whether that's happening or not. But try to focus on something to take that, shift the focus away from the negative, the thoughts that you're having. Write stuff down. Again, a bit like the talking, all that stuff going on in your head. If you get it down on paper, it helps to clarify things. It helps to organise your thoughts and rationalise things. So take time, write stuff down, make lists, see if what's going on in your head actually makes sense on paper, and have a notepad with you at all times, whether that's at night time, whether that's during the day or work. But writing stuff down can be really helpful. Reading, whether that's a novel, non-fiction or fiction, any kind of book which will kind of take you away from the thoughts you're having. It's trying to escape from the negativity and focus on something else. It could be educational. It could be around understanding your issues, the brain chemistry, those sorts of things, or some kind of book to take you away. Some sort of fantasy type book or fictional book that you can really get stuck into. This will take your mind off everything else. So films and TV, again, taking your mind off things, something to look forward to, something to get your interest, something might make you laugh, a comedy program or a drama or a film, anything like that which can help reduce anxiety by taking your mind off things and getting you focused on something else. Find something you're passionate about or something that's going to inspire you, whether that's a hobby or whether it's a person or something that you can really get interested in. And the more you think about it, the more excited you get, the more passionate you get. It will inspire and motivate you in a positive way. So try to think of things that will do that to you. What is it you find exciting and interested in, and spend time on that. It's positive and productive. Animals, it might be, you've got a dog or a pet, and that can be really calming. It can be really nice to spend time with. It could be that you've got a friend and you go out for a walk with their dog or go to a zoo or something. Animals, for most people, will be really positive in that they're interesting, they can be funny, they can be cute, and animals can have that real calming effect too. So whether you've got animals or not, there's lots of things you can do which potentially can be beneficial. Patience. Unfortunately, everyone wants a quick fix. They want a magic wand, they want everything to be better, but you have to understand that things will take time, and you've got to have patience, and you've got to accept that. And particularly with anxiety, if you're constantly looking for those answers or looking for something that's going to help, then you've got to become more patient. And with more practice, it's easier to deal with. You've got to be proactive, but also be patient with everything you're doing. Eating and drinking, as I mentioned before, that can have a big impact on your health and well-being. But things like taking time to cook a meal, spending that time, that focus, that energy on doing something productive and most likely healthier for you. Sleep, it's obviously really important, and anxiety plays a huge role in lack of sleep. But taking that time to focus on what you can do to help the situation. So although anxiety may be the main cause of sleep issues, there are probably other factors as well. So look to understand, what you can do better to help with your sleep. Time management and planning, writing things down, making lists, prioritizing, is this the best use of your time? Preparing and planning for things is all going to be helpful. Simplifying life. That whole concept you mentioned about traveling light, don't overburden yourself with things. Try to get things in order. Stop doing the stuff that doesn't matter. Going back to the planning, prioritize things. Try to make your life simple. Get perspective. It's very easy to get things out of perspective. So take that time to step back, think, how important is this? Is this really that bad? Is this really happening? Is this going to be an issue in a few months' time or a few weeks' time? Just try to get perspective on the situation. The chances are your life is much better than you perhaps think it is at the time, and try to focus on those positives that you have. Laughter, great. Smile, laugh, sense of humour. Try to do as much of that as you can. Smiling and finding things funny, chatting and having a joke with friends, watching a comedy program, watching cats play the piano on YouTube, whatever it might be. Laughter can be really, really beneficial in all sorts of ways, but particularly with anxiety. Quotes, another very simple but effective way. lots and lots of different quotes that people can use, and you can use your favourite quotes to inspire, to motivate, to put things into perspective. Very simple and effective. So look to see, what quotes are out there. There's quite a lot in the book that you may find beneficial. Hobbies, you sort of touched on that with a sort of passion and inspiration, but find a hobby or hobbies. Look at things that perhaps you've done in the past that you've enjoyed, or things you've always wanted to do but never tried it out, and make the effort. Whatever that might be. It could be gardening, painting, drawing, photography, some kind of sport, exercise. Find something that's going to get you excited and interested in, and you're going to make the effort for, and that will have a huge positive impact on any anxiety issues. And then finally here, professional help. Don't be afraid to ask for help. Try and do your own research, try and understand it yourself, but there'll be times when you should go to a doctor, should seek professional help, find out what is available out there. You may not find the answers, you may not get the response you're looking for, but getting professional help, whether that's therapy, counselling, medication, psychiatry, whatever it might be, don't be afraid to seek professional help. In terms of treatments for anxiety, so let's say you have anxiety. It could be diagnosed officially or not, but let's say you're looking for a treatment. And in terms of recognised treatments that are available out there, then you've got medication. Lots of different types of medication that may be helpful. What I would say is that it's really important for you to understand what that medication is, what it's designed to do, and also what the potential side effects are. So try as much as you can, if you're going to go to your doctor and be prescribed medication, talk to them and try to get an understanding. What is it for? What might it do? Why is it doing that? Why do you need it? And what the side effects are. So whether that's something like a antidepressant, or an anti-anxiety drug, or beta blockers, tranquilizers, whatever it might be, try to get as much information for yourself so you understand why you are taking it and what the potential effects are. Now, for some people, medication is going to be really, really helpful, life-changing, and absolutely recommended. For other people, it's not going to be beneficial, and actually may cause sort of side effects that make situations worse. So, it's a difficult one, but try to get as much information as you can. Don't be afraid of using medication if that is advised. But lots of different types out there which may or may not be helpful, but don't let ignorance be a factor. So, get the professional help, try to understand it, and then it may work well as a treatment. Then you've got CBT, cognitive behavioural therapy. So this is effectively, it's usually done in groups by a CBT practitioner, and it's all around trying for you to understand your thought processes and try to sort of adapt them in a more positive way and get rid of the negative thinking, but understanding why you think the way you do and come up with techniques and tools to help think more positively and productively. And it can be very effective. I mean, it does depend upon you actually understanding it and practicing it and applying the different techniques. But it can be very effective. And you can do it on your own. You can do it online. You can do it one-to-one. But probably the best thing initially is to consult your doctor around what options are available there. Something that's become more common in recent years is something called mindfulness. That's more about spending time really focusing on the present moment, and focusing on, in a kind of sort of meditation way, not thinking about everything else that is going on in your life, but just thinking for that period of time, what is happening there and now. And for a lot of people, it can be very effective just to really take that time to forget everything else and really focus on the situation, which will hopefully reduce the anxiety levels. You've got support groups that are available. Again, for some people, they'll be really effective. Having that social interaction, listening, understanding, other people's issues and situations, and being able to talk about theirs. Not for everybody, and in some ways it could potentially be negative in that it kind of almost enforces a lot of the negative thinking. As long as it's done in a way to actually look at how you can reduce anxiety and do productive things, then it might be helpful. So, do the research and look at support groups that might be available in your area. There's applied relaxation techniques. So we've said how important relaxing is, taking your mind off things, taking time out for yourself. And there are various programs you can do. There's therapists that can do relaxation sessions. So again, look, research, talk to people, try and get the advice, what's available there. There's also things like hypnotherapy. For some people, that can be very effective, and also acupuncture. So that's also potentially effective in terms of reducing your anxiety levels. But with all these things, it's important to do your research, try to work out, why might it be helpful? Do you think it will be beneficial for you? Is it something you want to try? But then make sure it's done by a professional, someone who's accredited, someone who's qualified, and give things a go. Try things. Everyone's different situations, circumstances, different reasons, the underlying specific causes. So look for as many options as possible. Try and get as much information on them as possible. Talk to different people. Talk to experts. Find out for yourself that information, but try different things. Some will work, some won't work, but there are lots of treatments out there, and you should never be in a situation where you don't think there's any answers or anything that's going to work. There's always something that could be beneficial. It might be that you suffer with anxiety and you're able to understand and then overcome that, which is fantastic for you. But then you're going to be in a much better position to be able to help other people. And it'd be great to be able to help other people in this situation. It could be that you don't personally suffer with anxiety, but you want to help others. You might have a partner, a family member, a friend who's suffering with anxiety issues, and this might be helpful in terms of helping them. So it's really important to listen. When someone comes to you with those problems, or if you suspect they have problems and you want to talk to them, really listen to them. It's so important to do that, rather than just sort of listen to them just to reply back. Listen to them to really understand, what they feel the issues are. Try to empathise with their situation and their circumstances. Try to get as much information and detail as possible. You've got to be patient with them. Again, things, there are very rarely quick fixes. So you've got to be patient with them. Things will take time. Give them that time, but don't expect, very, very quick improvements. Get them to be patient too. So you need to be patient. They need to be patient. Also, ask the questions. Is this anxiety? Is anxiety the main issue, or is it a kind of an effect of other things? Is it confidence issues? Is it the self-esteem, the self-worth? Is it a particular event, a particular circumstances, or a particular person that's caused this? Is it depression? Different types of depression. What are the factors? What is the actual situation? Try to understand that, and it might not be anxiety, might not be the main thing going on here. Talk to them about the related issues, or try to understand those related issues we mentioned: the stress, the depression, but things like alcohol, drugs, sleeping, food, eating too much, not eating enough, those sorts of things. Try to understand the related issues around that. Then the effects, find out what are the effects for them personally, and what effects does it have on their life, but also other people in their lives, their family, their work, etc., their financial position, all those different things. The underlying specific reasons we talked about before, go through those with the person and try to identify. In some cases it'll be really obvious what the problems are, what those reasons are, and for other people it'll be less obvious. But try to go through those and get kind of a almost an organisation, make it organised in terms of how you're dealing with this. Start from the beginning and work your way through all the different potential causes, reasons, and the effects. The questions to ask, ask them about how they're feeling, when they feel that way, what's going on, and then the questions around, what advice would they give their best friend? Is this something they feel would matter in a year's time? All those sorts of questions, and the talking element to it, really, really important. There are some quick wins and instant help tips we talked about. It might be just talking, going for a walk, doing a bit of exercise, playing some music. Those sorts of things can really help as a quick win in those situations. Then there's the anxiety toolbox you've mentioned. So explain to them what the toolbox is and get them to write down all the different things or suggest things to them and see what their reaction is, and try to fill that toolbox with as many different options as possible. Other support, find out, have they got other people they can talk to? Have they got people who will understand, will be supportive, will help with them in whatever it might be, whether it's going for a walk, going for a talk, watching a film at the cinema with them, whatever it might be. Have they got other people that they that will help support them? Then there's professional help. So a lot of people will be scared of that. I think it's important to try to ask them, have they sought professional help? Potentially go to the doctor with them, so that you'll be there to support them, help with the research, find out what sort of help might be available and what sort of support networks there are locally. Try to get across to them that a lot of this is about effort and reward. If you put the effort in to understand and to practice and to apply the things that are going to be beneficial, you will get rewarded. You will feel better. It will, it's a natural equation. The more effort you put into it, the more reward you're going to get. Now, there'll be times when certain things don't work, but at the end of the day, if you put the effort in, if they put the effort in, there will be benefits. So try to get across them that practice. Things will get better. You can manage this. You can overcome it. You can prevent it, and get them to see that. And in many cases, it will be become quite clear of how beneficial that is. Finally, though, don't get too involved. There is a danger that whether it's someone with anxiety or depression or stress, that if you get too involved with that situation, that can bring you down too. Someone you care about, and that can bring you down. So do as much as you can, but just be careful that your health is really important, and you don't want that compromised as well. So it'd be great to help people, offer that advice, give them that time. So many things you can do, so many things that will be beneficial and productive, but just be careful to make sure you look after yourself too. And finally, going forward, obviously I'd recommend reading the book. It goes into much more detail around different types of anxiety, the causes, the reasons, the effects, and also what you can do to help overcome anxiety. So it is available from Amazon and from iBooks, paperback and ebook Kindle versions. The other books are available too. So have a look at those: stress, depression, confidence, motivation, healthy eating, sleep, benefits of exercise. And there's also the other online workshops. So take a look at the other workshops, the books, check out the website, and the Facebook pages, the email address, get in touch, and good luck. I mean, it's something that will affect so many people in so many ways, but I honestly believe that if you've got that understanding, you've got that knowledge, and you take that time and keep practicing, you can absolutely lower your anxiety levels and have a much happier, healthier life. Thank you.